I have Jane Doe right here. She was just born. I've already completed hand hygiene. She's been alive for about an hour and a half, so she's already had skin to skin on mom. She already has her 2 patient identifiers on her hand and her ankle, and she's already had both APGAR scores completed. Okay, I have already completed the measurements as well, and the blood pressure. Length of the baby was 50 centimeters, weight was 3,000 grams, head circumference was 33 centimeters, and chest circumference was 32 centimeters. The blood pressure was 70/42, and these all fall into normal range. So I'm going to start with my head to toe assessment. Starting on the head, I'm going to take the baby's hat off. Baby should have a hat on to promote their thermoregulation. Feel the baby's head, and I can feel the fontanelles. They are flat. I can feel the sutures as well, and they are connected, which is good. They should not have space in between them. That is abnormal. Baby does not have any swelling or molding of the head. Everything seems normal. Moving on to the ears. The ears are fully formed, and they are in line with the inner canthus of the baby's eyes. There's no skin tags, no pits. They seem normal. Baby's eyes do not have any drainage in them. They are blue in color. No epicanthal folds, which is a good sign. And there's no strabismus or pseudostrabismus. The eyes are straight. Moving on to the nose and the nares. So I'm going to place my finger in the mouth and plug one of the nostrils and the other one. While I was doing that, baby's nares are patent and sucking reflex is there. There is no grunting, there's no nasal flaring, so that is important for my respiratory assessment. Moving on to the mouth, I already assessed the inside of the mouth by feeling while I was doing the sucking reflex. Now the baby is crying. There is no cleft palate or cleft lip, no tongue tie, and again, sucking reflex was there. There is no Epstein pearls in the baby's mouth either, and there's no cyanosis around the baby's mouth. Baby's neck. The trachea is midline. I'm palpating the neck. There's no masses, no clavicle fracture, and no webbing of the neck. Moving on to the baby's chest, I'm going to expose the baby just a little bit while trying to keep them warm, just exposing the chest. The nipples are symmetrical, falling on the midline. Chest is barrel shaped. While I'm doing this, I'm also assessing the skin on the chest. Skin looks good. It is pink in color. I'm going to go ahead and listen while I have the chest exposed as well for my respiratory rate, my heart rate, and my bowel sounds. Wrapping the baby back up. Baby's heart rate was 110 beats per minute. There were no murmurs present. If there were, I would grade them. I would grade it and determine if it was in the systolic or diastolic. Respiratory rate was 45 breaths per minute. Lung sounds clear, no crackles. There's no signs of apnea. Baby did not pause their breathing for more than 20 seconds. I'm gonna move on to the hands. So I'm just, again, gonna just pull the hands out, keeping the baby warm. Looking at the baby's fingers, it looks like there are 10 fingers. There's no webbing, no creases on the hand. while I'm have the hands out, I'm gonna check the brachial pulse. And since I'm checking pulses, I will check the femoral pulse. Okay, both are +2. Skin. The hands and the feet of the baby are pale, however, the rest of the body is pink, so it does have acrocyanosis, but that is a normal finding for babies. There's no signs of vernix, which is like the cheese-like substance on the baby, or languno. There's no milia, there's no bruises, there's no rashes. Baby does not have any birthmarks. If there were birthmarks, I would measure them and try to determine what kind of birthmarks they are. If they are large, that is bad, so I would document that. Again, going back to the abdomen is rounded, bowel sounds were present, normal, active. The umbilical cord has 3 vessels, 2 arteries and a vein. Moving on to the genitals, this is a little girl. She does not have any discharge. The labia majora and the labia covers the minora, which is an expected finding. Moving on to the spine, I'm gonna flip the baby over real quick. Spine is intact. At the base of the spine, there is no hair or dimpling, and the spine is straight. For our extremities, baby does have a full range of motion. Again, turning the baby over again. The rolls on the baby's legs are symmetrical, meaning the legs are not different sizes. There's no signs of clubfoot, and moving on, the baby has had their first stool, so the anus is patent. While I'm here, I'm going to check the baby's temperature, axillary, and the baby's temperature was 37.1. I'm going to now check the baby's reflexes. So the moral reflex, I will startle the baby, and the baby's extremities should go out and then come back in, which this baby did do. I'm going to test the rooting reflex, which I will brush the baby's cheek on one side, and the baby should turn their head to that side, trying to find the nipple or my finger in this case. The Babinski reflex, so I will stroke the bottom of the baby's foot. The big toe should go towards the baby, while these other little toes should go out, fan out. And again, there's no webbing on the feet either. The stepping reflex, so I would pick baby up, place baby's feet on the ground, and baby should take steps while I am holding the baby. The tonic neck reflex, I will turn the baby's head, and the extremities on that side should go out. And then finally, I will complete the Ortolani test, which is when I take the legs out, push the hips up, and then bring the legs back in and push the hips back down. This is to test for hip dysplasia. If I hear any cracking, popping, or feel any resistance, that is bad, and that is something that I would note. So now that this baby is finished with their assessment, I'm going to wrap them back up. Again, they should have a hat on their head, and I'm going to take them back to mom.